Good day once again. I'm Teacher Michael again, and welcome to Science 9. First quarter, we're going to discuss this time the Module 2, which covers the week 3, the effects of lifestyle in the function of respiratory and circulatory system. Our learning objective for this module is infer how one's lifestyle can affect the functioning of respiratory and circulatory system. Let's have a recall on what we have discussed or learned from our Module 1. Let us recall the concept and learn what we have learned from the previous lesson by answering the following questions. What are the primary functions of the respiratory and circulatory systems? Do you still remember? What is the function of respiratory? That's correct. Its main function is for our respiration or breathing. How about circulatory system? That's right. Its main function is to circulate the nutrients and oxygen to the different parts of our body. What are the parts of the respiratory system? Do you still remember the parts of the respiratory system? Can you tell it to me? What are those parts? Very good. How about the circulatory system? What are those main parts of circulatory system? Nice, you still remember. Can you name the parts by labeling the illustration below? What do you think is this part? Nice, that is nose. How about this part? What do you think is this part? Very good, that is the trachea. How about this part? What do you think is this part of respiratory system? Nice, that is our lungs. How about this one? What do you think is the part of this circulatory system? What do you call on this part? Nice, that is our heart. How about this one? Very good, that is our blood vessel. Are you familiar with the poster shown at the left? Those posters are very alarming, and it shows warning. Do you know how we can acquire those diseases? I hope you know. Today, we're going to discuss the diseases of respiratory and circulatory system, the diseases that could affect those systems. The first part we're going to discuss is the diseases of respiratory system. Do you know any diseases that could affect our respiratory system? I hope you already have an idea. The first disease that could affect or that is affecting our respiratory system is asthma. Asthma, it is a common continuing respiratory condition that causes difficulty in breathing due to inflammation of the airways. What are the causes? Not exactly the causes, but triggers. There are triggers. What are those triggers? It could be allergies, smoking, and weather. Once we encounter or a certain person who has an asthma encounter his or her triggers like allergy, smoking, or smoke or weather condition, she could suffer or she or he could suffer this kind of disease, which is asthma. What are the symptoms? It could be coughing, wheezing, chest pain, shortness of breath, trouble, and sleeping. How can we avoid or prevent asthma? Avoid asthma triggers and get vaccinated for influenza and pneumonia. If you are having asthma, you can treat that using the asthma inhalers and nebulizer. Another disease that could affect that is affecting our respiratory system is the chronic obstructive pulmonary disease or COPD. It is a development of sputum, or it is a thick mucus or phlegm, makes the infected suffer from difficulty in breathing. So it's because of the development of mucus or phlegm in our respiratory system. What are the causes of this COPD? Number 1 is cigarette smoking, emphysema, and bronchitis. Symptoms. What are the symptoms if you are having a COPD? Shortness of breath, wheezing, chest tightness, cough with sputum or with phlegm. Too much phlegm. How can we how can we avoid or prevent this kind of disease? Do not smoke and quit smoking. Treatment. If you are having this COPD, you have to do or to undergo in medication, lung therapy, and bronchodilators. The next disease is the chronic bronchitis. It is a disease that makes the bronchial tubes swell. So, it is a disease that affects our bronchitis, that makes the bronchitis inside the tubes makes it swell o namamaga. What are the cause of this chronic bronchitis? Cigarette smoking, the dust, smoke from burning coal, and air pollution. Symptoms. If you're having this chronic bronchitis, the symptoms that you can encounter are cough with sputum or too much phlegm, wheezing, tight chest, shortness of breath. How can we prevent or avoid this kind of chronic bronchitis? Do not smoke and quit smoking. If you are having this chronic bronchitis, the treatment that you can do is bronchodilators and surgical procedures. Another disease of our respiratory system is emphysema. It is another form of COPD that causes damage to the air sacs in the lungs or alveoli. So this kind of disease damages our alveoli. Those alveoli or air sacs are inside of our lungs. Causes. What are the main causes of this emphysema? Cigarette smoking, air pollution, chemical fumes, and dust. What are the symptoms? Frequent coughing and wheezing, shortness of breath. How can we avoid or prevent ourselves from having emphysema? Do not smoke, quit smoking, and avoid secondhand smoking. Treatment. If you are having emphysema, you can undergo in medications, lung therapy, and surgical procedures. Another disease in our respiratory system is the lung cancer. Bumps are shaped in the lungs that cause cancer. So these are the cancers that could develop inside of our lungs. That is what we call the lung cancer. What are the causes? First is cigarette smoking, secondhand smoke, genes changes. What are the symptoms of having this kind of disease? Cough that does not go away, coughing up blood, so ikaw ay umubo na ng dugo, shortness of breath, chest pain, headache, and hoarseness. Prevention. How can we prevent lung cancer? Do not smoke, quit smoking, avoid second-hand smoke. Treatment. If you're having this kind of cancer or lung cancer, surgery, chemotherapy, and radiotherapy. Another disease that could affect our respiratory system is the tuberculosis. The tuberculosis is caused by the Mycobacterium tuberculosis. It is the bacteria that could get inside of our lungs. The Mycobacterium tuberculosis targets the lungs and damages the other parts of our body. Causes bacteria called Mycobacterium tuberculosis. Symptoms: cough that lasts for more than 3 weeks, chills and fever, weight loss, chest pain, coughing up blood. Prevention. We can avoid this having tuberculosis, having a physical distancing, good ventilation, and good hygiene or proper hygiene. Medication treatment, we can have the treatment and we can undergo in medication. There's a 6-month medication in the Philippines to avoid or to treat this kind of disease. Another disease of our respiratory system is the pneumonia. It is the swelling of alveoli, which is caused by bacteria, virus or fungi. So pneumonia is caused by the viruses or bacteria or the fungi, pamamaga ng ating mga alveoli na nasa loob ng ating lungs. Causes, bacteria, fungi, viruses. So those viruses can include the SARS-CoV or the severe acute respiratory syndrome coronavirus, or the MERS-CoV or the Middle East Respiratory Syndrome coronavirus, and the recently SARS-CoV-2. What are the symptoms? We have the chest pain, cough with phlegm, fatigue, chills and fever, shortness of breath, nausea, o pag parang ikaw ay naduduwal, and vomiting. Nahihilo dahil sa pagduduwal yung nausea and vomiting. Prevention. We can avoid having this kind of disease if we get vaccinated. There's a pneumonia vaccine that's available now in the market. Good hygiene and most especially do not smoke. If you are having pneumonia, treatment is if your pneumonia is caused by bacteria, you have to drink antibiotics. But if it is viral disease or viral infection, so one of the cause of your pneumonia is virus, you have to rest and drink lots of fluid. And the most relevant this nowadays, which is also a disease that could affect our respiratory system, is what we call the coronavirus disease or COVID-19. This new disease comes from a type of coronavirus named the SARS-CoV-2 or the Severe Acute Respiratory Syndrome coronavirus 2. Symptoms show up to 14 days. Some are asymptomatic but no symptoms show, but they are already infected and can spread the virus if not in isolation. Again, what's the cause? The Severe Acute Respiratory Syndrome coronavirus 2 or the SARS-CoV-2. That's the virus. That's the name of the virus. The most common symptoms if you have a COVID-19 is fever, dry cough, and tiredness. Yun yung most common. Yun yung pinakamadalas na manaramdaman ng isang taong may COVID-19. Ano naman yung less common symptoms? Yung hindi masyadong nakikita sa mga COVID-19 pero symptoms pa din siya. Aches and pains o yung pananakit ng katawan. You have the sore throat, you have a diarrhea, conjunctivitis or yung pamumula ng mata. We have the headache, the loss of taste and smell, at saka rashes. On the other hand, we have the serious symptoms also. So, seryoso na ang COVID-19 mo, you are in critical case. Kung ikaw ay nakakaranas na ng difficulty in breathing, chest pain, loss of speech, and movement. So, critical na ang COVID-19. Now, what are the prevention that we can do to avoid this kind of COVID-19, having this kind of disease, which is spreading right now? It is very important to wash hands regularly because washing hands can remove and kill the viruses that could attach in our hands. Maintain physical distancing, so at least 2 meters apart from each other to avoid the spread of the disease. Avoid touching your face. Cover your mouth when coughing and sneezing. Avoid smoking. It is very important to wear a face mask and always stay at your home. Now we know the different diseases that could affect our respiratory system. This time, we're going to discuss the disease of the circulatory system. The first disease that we're going to discuss under the disease of circulatory system is the atherosclerosis or arteriosclerosis. It makes the arteries hard, caused by high consumption of fatty diet that leaves fat deposits on the lining of the blood vessels. These fat deposits make the arteries rigid. So, because of too much cholesterol na kinakain natin, those fats na dun sa or cholesterol na mula sa kinain natin could make our blood vessels rigid. Nagiging narrow siya, nagiging masikip ang daluyan ng ating dugo o yung mga ugat natin kumakapal siya. dahil sa pagkakaroon ng mga fatty deposits or the cholesterol. Causes: high blood pressure, high cholesterol, cigarette smoking. So, having a high blood pressure, high in cholesterol, and cigarette smoking can cause this kind of circulatory disease. Symptoms: chest pain, transient ischemic attack, and the kidney failure. The prevention: we can prevent this from avoiding smoke or quit smoking. You have to do regular exercise and eating healthy foods, less in fats, less in cholesterol. If you're having this kind of disease, it is very important to undergo in medication and surgical procedures. The next disease under circulatory system is the heart attack. So actually, heart attack is the second cause of or one of the main cause of the death in the Philippines. It is caused when the heart is blocked from the blood supply due to a blood clot. Okay? Causes: blocked arteries, o yung isang arteries ay na-block or nagsara. Coronary artery disease also is one of the cause of heart attack. Symptoms: pressure in chest, aching sensation that spreads to neck or jaw. So yung kapag ikaw ay nagkakaroon na ng pananakit mula dun sa neck papunta sa iyong jaw. So it could be symptoms of heart attack. Cold sweat, fatigue, o pagkapagod, shortness of breath, and nausea. Prevention: if you have to avoid or to prevent us from heart attack, it is always for us to have a medication, regular checkup, exercise regularly, eating healthy foods. So if you undergo or experience heart attack, you have to undergo medication, surgical procedures, and cardiac rehabilitation. Another disease of circulatory system is the myocardial ischemia. The buildup of fat deposits congest the blood flow to the heart. So there's a buildup of fat deposits inside of our heart. Okay, so that's what we call the myocardial ischemia. Causes: the blood clot, arteriosclerosis. Kung ikaw may arteriosclerosis, there's a tendency you will have this kind of disease which is inside of your heart. Coronary artery spasm. Symptoms: neck or jaw pain, shoulder or arm pain. So fast heartbeat, nausea and vomiting, sweating and fatigue. How to prevent this kind of disease? You have to avoid smoke and quit smoke, exercise regularly, eat healthy foods. Medication: it is very important if you experience this kind of disease. One of the treatments is to undergo medication, procedure to improve blood flow. Another disease under circulatory system is the heart failure. The unstable behavior of the heart cannot pump sufficient blood for the body's needs. So it's because of the unstable behavior of our heart. For that reason, heart fails. What are the causes of this heart failure? Faulty heart valves, hypertension, abnormal heart rhythms, abnormal na pagtibok ng puso, the chronic diseases such as diabetes and AIDS. Symptoms: if you have heart failure, these are the symptoms: shortness of breath, fatigue, rapid or irregular heartbeat, increased urination, chest pain, lack of appetite, and nausea. How to prevent this disease? Do not smoke, quit smoking, regular exercise, and eat healthy foods. If you experience heart failure, it is very important to undergo medication and surgical procedure. Another disease that could affect or that is about the circulatory system is the stroke. It can happen if a blood vessel that supplies blood to the brain either becomes blocked by a blood clot or burst. This stop blood flow and prevent oxygen from getting to the brain. So there's a blood vessel which is connected to our brain that's being blocked. So once it is blocked, therefore the oxygen will not deliver to the brain through our blood. So that's the time you get stroke. Causes uncontrolled hypertension. Kapag ikaw ay high blood at uncontrollable ito, it could be lead to a stroke. Trauma from accident, kung aksidente ka, and also the hemorrhage or yung pamubuo ng dugo. Symptoms: trouble in speaking. Once you have a trouble in speaking, it's a symptoms that you have a stroke. Paralysis, headache, and trouble walking. Prevention: control hypertension. Do not smoke. Quit smoking. Exercise regularly and eat healthy foods. If you experience stroke, you have to undergo medication. Another thing or disease under circulatory system is the high blood pressure or the hypertension. It is the most common disease or illnesses of some of us. The elevation of blood pressure in the blood cells gets too high that it can trigger other diseases. So having blood pressure can cause different diseases. For that reason, it's very important to do regular checkup for you to be able to control and update or manage your blood pressure. What are the causes? Kidney problems. If you are having kidney problems, there's a tendency you will have a high blood pressure. Adrenal gland tumors and illegal drugs. Symptoms. Most people do not have any symptom, but few people may have having headache, shortness of breath, and nose pains. Prevention and treatment: do not smoke. Quit smoking. Exercise regularly and eat healthy. Another disease under circulatory system is the insufficient supply of red blood cells in the blood can make you feel easily and tired. That is what we call anemia. So there's an insufficient supply of red blood cells. What are the causes? Your body does not make enough red blood cells. Your body destroys red blood cells. Red blood cells are very important because it carries the oxygen. If you are having enough or you will not having enough red blood cells, there's a tendency you will not have enough oxygen in your body. Symptoms: fatigue, pale skin, yung pamumutla, shortness of breath, dizziness, and chest pain. Prevention: we can prevent this by eating iron-rich food, take vitamins B12 and vitamin C, and eat healthy foods. Treatment: so if you are having this anemia, you have to undergo medication and blood transfusion if it's already critical. Next is the having high cholesterol. So it's still one of the disease in our circulatory system. Causes: too much consumption of foods high in bad cholesterol. Okay, so you have to watch always the food that you're going to eat. It should be less in cholesterol. Symptoms: usually has no symptoms. How to prevent having high cholesterol? You have to do not smoke, quit smoking, exercise regularly, eat healthy foods. Having learned or from learning those concepts or diseases of respiratory and circulatory system, it is very important to take note of this. Prevention is still better than cure. I want you to look at the picture. Okay, so healthy or unhealthy. So the girl is thinking which she is going to choose. Which do you prefer? Fresh apple or a quarter pound of burger with cheese? Which do you prefer? A banana or an ice cream cone? What do you want to do? To exercise or to slack off and watch movies all day? When do you want to sleep? At 9 p.m. or at 2 a.m.? Remember, whatever you do, you must always think that you are compromising your health. For that reason, you have to choose a healthy lifestyle. These are the tips that we can do to have a healthy lifestyle and to avoid those diseases. The first tip, or the first thing that you can do to avoid those diseases is number 1, avoid cigarette smoking. Why is it dangerous? It comprises a lot of substances that are hurtful to both the smoker and the individual around the smoker. It compromises both the respiratory and the circulatory framework and even our entire body. So this cigarette is very harmful because of its composition. It composed of different dangerous substances that makes this cigarette very harmful. Cigarette smoking can cause respiratory and illnesses by harming the parts of your respiratory system. It is increasingly regular for a cigarette smoker to have a lung illness than non-smoker. Cigarette smoking additionally represents more serious hazard for ailments that influences the circulatory system. It is the reason behind the numerous sorts of circulatory ailments, for example, the stroke, hypertension, and iron deficiency. Although the cigarette smoking can affect the first the first part or the system that could affect by cigarette smoking is our respiratory system. Once the respiratory system become affected, there's a tendency our circulatory system also become affected. For that reason, it is very important to avoid smoking or do not smoke. Do not try to smoke. Another important thing that you can do to avoid those diseases is have a healthy diet. A healthy dieting routine does not mean you simply need to eat berries and beans, but also other kinds of foods. Eating a well-balanced diet can help prevent you from having diseases. Your go-to guide on what's optimal to eat is the food pyramid. So this is our food pyramid. Remember, you are what you eat. So this is the food pyramid, meaning to say you have to have a lesser sweets, okay, lesser dairy products, lesser vegetable oils, and you have to gain more of these whole grains, legumes, and soy, and eating more of these vegetables and fruits. Another thing that you can do to avoid those diseases is to have a regular exercise and adequate rest. Keeping your body active can help your respiratory and circulatory system strong. As per the Center for Disease Control and Prevention's suggestion, at least 150 minutes of exercise each week improves the prevention of the diseases. And it's very important to have a proper hygiene. Washing your hands appropriately for 20 seconds, particularly in the wake of wheezing, coughing, or cleaning out your nose, assist with shielding you and others from ailments such as colds and influenza. Protect yourselves by wearing a protective mask. This is very important, especially this time that we are confronting a pandemic. So those are the things we can do to avoid those diseases. That's all for today. Thank you for watching and listening. Have a nice day.